200 people in the U.S. die every day from hospital-acquired infections. That's organisms like C. diff, MRSA. And we've been proven to stop that in the hospitals. And as a science-driven company, we were very happy to partner with Texas Biomed to go ahead and get the evidence that we are effective against anthrax and Ebola. Every hospital is faced with the need to create a procedure and a protocol for high-risk pathogens like Ebola or anthrax. And what we wanted to do was we wanted to validate our technology to make sure that it was killing anthrax and Ebola, and be able to give that to the hospitals so they could use it for their protocols. So right now we're in the suit room at Texas Biomed, one of 6 BL4 labs in North America, and behind me is the door that goes to the BSL4 lab where the robot was tested. We were thrilled to be able to partner with Texas Biomed. They're right in our backyard. We're in San Antonio, they're in San Antonio. And not only is the capacity there to test Ebola and anthrax, which only a few facilities in the country can do, but Texas Biomed was very willing to collaborate with us. We needed to create kind of custom protocols. Our robot doesn't fit under a hood, a lab hood, very easily. So we had to collaborate and create some solutions so we would be able to do the testing. For both Ebola and anthrax, we tested a number of different time periods. So for Ebola, for example, we did 1 minute and up to 5 minutes. And for anthrax, we did longer time periods because anthrax is much more difficult to kill. On all the tests, there was no organism recovered after Xenix was used, which we were thrilled about. That amounts to a 3-log kill on the anthrax and a 4-log kill on the Ebola. So we were very, very pleased with the results. The robot uses what's called a pulse xenon bulb, and what happens is there's an inert gas in there called xenon, and we create a plasma. And when we do that, it produces a high energy UV, or what's called UVC, or germicidal UV. That doesn't naturally occur on Earth, so the bacteria and viruses don't have any resistance to it. It's able to penetrate the cell walls and essentially fuse the DNA, making those organisms, so the C. diff, MRSA, kind of the superbugs that we all worry about, making them unable to replicate or cause any kind of infection. Currently, the technology is being used in acute care hospitals for the most part, and we're in about 300 of those. And the typical way it's used is it's placed about 5 minutes in a patient bathroom, and it's run there, and 5 minutes on either side of the bed between patients. And what that does is it protects the next patient who's entering that room, creating a safer environment for the patient. What we hope is that by hospitals having our robots in place already, for routine use, for really attacking the hospital-acquired infections that occur every day in a hospital, the superbugs we all hear about, C. diff, MRSA, and by having the robots there, they're run every day. And so in the rare event that a suspect pathogen is there, a patient that we're not sure of, they'll have almost an instantaneous response. They'll have an advanced level of automatic disinfection that they can just apply right away without having to wait or make any determinations. We're very proud that 7 of our hospital customers have actually published studies on the impact of using pulse xenon for room disinfection on their infection rate. So these are facility-wide infection rates. So we're looking at 53% reductions in C. diff, 57% reductions in C. diff, up to 70% reductions of C. diff in an ICU. We also see facilities, operating rooms reporting surgical site infection reductions, long-term care facilities reporting C. diff infection rate reductions. So we're very thrilled that by applying the UV device, our technology, on a routine basis, they're able to really protect patients.